Good evening, ladies and gentlemen, friends and well-wishers. Dr. Amitava Biswas from Sunetra Family Eye Care Center, Kolkata, bringing to you our 35th episode of Facebook Live Patient Care Education Series. Week after week, usually on a Wednesday, sometimes on a Thursday. Today's topic being leprosy, a disease which is often misunderstood and feared by many. It is an infective disease which can lead on to damage of the nerves, upper respiratory tract, skin, and even the eyes. Leprosy has affected humanity for thousands of years. The earliest evidence dating back to 2000 BC, leprosy finds mention in ancient Indian scriptures, Atharva Veda and Kaushika Sutra, and the name is derived from Greek words lepra and lepis. The ailment is also known as Hansen's disease after a Norwegian physician, Gerhard Armeur Hansen. India houses the world's largest population of leprosy patients, and to tell us more about the physical, social, and emotional aspects of leprosy, we have with us three stalwarts who have dedicated their entire careers to the cause of treatment, cure, and eradication of leprosy. The first among them, Dr. Loretta Das, MBBS and MD Internal Medicine from Christian Medical College, Vellore, has been working with the Leprosy Mission for over 30 years now. It is an organization committed to do whatever it takes to address all aspects of the problem that leprosy causes. Dr. Shamla Anand is an ophthalmologist, and she also is an MBBS graduate from CMC Vellore with more than 30 years of experience in leprosy, particularly ocular leprosy. She lives in Hyderabad now and is currently working as Senior Technical Advisor for Neglected Tropical Diseases with the American Leprosy Mission. And we have with us Professor Premal Das, MBBS and MS General Surgery from CMC Vellore as well, working with the Leprosy Mission for 36 long years. His specific areas of interest are prevention and correction of leprosy deformities. More about him later when he starts his talk. We get going. Welcome all three of you to this show. Good to have you all. Let me unmute the mic for all of you.
Thank you.
So, how do we get going? Dr. Loretta Das, would you like to speak something about leprosy to begin with?
Yeah, can I start with the slideshow?
Yes,
directly.
Please.
Start. Okay, thank you, Dr. Biswas, and good evening to everyone watching. I'm going to give you an overview of leprosy. Like Dr. Biswas said, my aim of this talk is to help you understand the disease, help you get rid of any fears of the disease that you have, hopefully have you increase awareness about leprosy in your communities, and be sympathetic towards the needs of people affected by leprosy. Now, leprosy is a chronic infectious disease caused by a germ called Mycobacterium leprae. This germ is very similar to the germ that causes tuberculosis. The reason I'm saying this is so that we all understand that leprosy is an infectious disease, just like any other. There seem to be so many myths and misconceptions about the disease. It is a disease of skin and peripheral nerves. The reason I've highlighted peripheral nerves is because that is the problem that causes long-term deformity and disability and stigma and a lot of related problems for the patient, even after the patient is treated and cured. Below, you can see that I've written very clearly, leprosy is treatable and curable. But if treatment is delayed, there can be permanent nerve damage and deformity. So all patients must report early. Another important thing to understand is the spread of the disease. Leprosy is not spread by touch. There is so much fear of touching people affected by leprosy. Leprosy is not spread by touch. It is spread by droplet infection, mainly from the nose. You can also see that it is a very lowly infective disease. I call it the least infectious of infectious diseases. Yet we are all so scared of contracting the disease. It is very difficult to get leprosy. 97% of our population will not get leprosy because most of us have a very good immunity against the disease. And also you need to be in long-term contact with someone who has a high load of germs in their nose. So this usually happens in families and in communities where there is a lot of leprosy. But again, if they are diagnosed and treated early, there should be no fear of contracting the disease. The downside is the last point that I've written is what we call the incubation period. The time from infection, that's the germ entering the body, to the first sign and symptom is very long. It can be, average is 2 to 4 years, but the range can be up to 20 to 30 years. And that is where the problem is. It is the people who are not yet diagnosed that are spreading the disease. Once a person is diagnosed and started on treatment, now this is the good news. Once they are started on treatment, they will not spread the disease. Within 2 to 3 days, the germs in the nose are dead and they are non-infective. So we should not be afraid of anyone who's diagnosed and started on leprosy treatment. This just reinforces what I just said. Most people, most of us, 95 to 97% of us will not get leprosy because we've got excellent immunity and the germ is very weak. Here I'm showing you signs and symptoms of leprosy. The commonest sign is a hypopigmented patch, a whitish patch. Sometimes it is reddish. It is very important that people, when they get this patch, whether it's 1, 2, or many, come early to the doctor, to the correct doctor, the dermatologist or the government hospital, get their diagnosis confirmed and treatment started. If this is done at the very early stage, we can prevent the next major problem highlighted in red, which is nerve damage, which, like I already said, once the nerves are damaged, you will get permanent deformity and disability and stigma and all the other problems which we associate with leprosy. And there's a lab test, that is the slit skin smear. I won't talk about that. Other signs of leprosy, which are not so common. The patch is the commonest. If we just remember the patch and come early, that's the best thing, the most important thing. But you can have nodules. You see the patients with nodules on the face, loss of eyebrows, thickened earlobes, deformed ears, collapsed nose. There are many small signs and symptoms. These are actually rarer, let me say. 30% of patients can present like this. These are the highly infectious patients. These are the patients who had no problem till very late, 8 to 10 years, sometimes even 20 years. These are the people who are spreading the disease, and these are the people who are very difficult to find. Showing you a little bit of the deformity. It will be discussed later by Dr. Shamla and Dr. Premal, who look after the eye and the other deformities in leprosy. Just to show you pictures, the hands, the feet, and the eye can be deformed, and this will be a long-term problem even after leprosy is cured. Some more pictures. Now, the picture below is a man who's lost all his digits of his fingers. These are the kind of patients you see on the street. I won't call them patients. They're called leprosy affected. They have had the disease. They have been treated, they have been cured. They do not have the germ, they do not spread the disease. But they have loss of sensation in their palms and soles. And because of that, they keep on getting injuries and wounds, which get secondarily infected, and then they lose digits. We have to really keep on teaching them how to take care of their hands and feet, which is something which is very difficult to do when you don't have sensation. Here I'm showing you families affected by leprosy. There are many like this. And the reason I'm showing it to you is not to, there are a lot of myths again. Don't marry into a family that has leprosy. Everyone's going to get it. It's not a hereditary disease. The reason everyone in the family is getting it is because that person who has a high bacillary load has been in close contact with his own family for many, many years. Again, the reason I'm showing you this is not to frighten you, but if one person has leprosy in the family, it is very important for all the other family members to be screened, to be checked, to be diagnosed early, and to be treated early to prevent deformity in the person diagnosed and to prevent further spread in that family and that community. So this is one way we can find patients early, is by looking at the rest of the family whenever we get a single leprosy patient. The good news, leprosy is treatable, leprosy is curable. The treatment is free, available at all government health centers in the country. These are the blister packs, just to show you, I'm not going to discuss it. But what you need to know is when you start treatment, you become non-infective. I want to reinforce that within 2 to 3 days. And also if you start treatment early, when the first patch or the second patch, there is much, much less chance of getting nerve damage and paralysis. These are two messages that have to go to the whole country. This is not so important, but just to show you what is lepra reaction. Reactions are like an allergy. The body's response to the germ. And so there is increased inflammation in the patches. They become red, raised. And the only important thing about these reactions is most of the nerve damage and leprosy occurs during these reactions. So it is important for doctors to know that when there is reaction, we have to give anti-inflammatory or immunosuppressive treatment urgently. The patient should come back to us. And this will decrease the chance of damage in the nerves. The nerve damage is almost always due to reactions. Some more pictures to show you reactions in leprosy where the patches are inflamed. And it's during this time that the nerves can be damaged and the paralysis and the sensory loss occurs. This slide is to show you the importance of a whole team work in leprosy. The physiotherapist, the occupational therapist, apart from the doctors, already you know you need a dermatologist, a surgeon, an ophthalmologist in the treatment of leprosy. But here the physiotherapist is very, very important, because when you teach them correct exercises early when there's nerve damage, there is good chance of recovery. Not only with leprosy, with any nerve damage. If physiotherapy is instituted early, there is good chance of recovery. Otherwise, the person is left with lifelong deformity and disability. We have patient education leaflets. There's no need to go into detail here, but just like in diabetics, when they have anesthetic palms and soles, they must protect, or they must be taught how to protect themselves from injury. So we tell them to, when they're holding something hot, to wrap a towel around the cup or the mug. We tell them to always wear footwear so that they won't get a thorn prick. Because when we get a thorn prick or we get injury, immediately we know there is a problem, we have pain. And when we have pain, obviously we're going to take care of that hand or foot, or we're going to go to the doctor. They don't have pain, so their wound gets worse and worse. Then it gets infected from outside, the dust, the mud, and then it gets what we call septic, it gets gangrenous, and they lose tissue and digits. Benefits of reconstructive surgery, Dr. Premal is going to talk about, so I'm skipping this slide. These are pictures to show you that every time you have a patch, you don't have to be afraid and think this is leprosy. What is important is go to the right doctor, confirm or check or verify whether this is leprosy or this is not. All these are patches that are not leprosy, so that everyone is not so scared that every single white patch or red patch is leprosy. These are also patches that are not leprosy. These are also patches that are not leprosy. These are nodules, most of which are not leprosy. I think the year one is. These nodules in leprosy, again, if they were leprosy, they would be highly smear positive. We have to do a simple test and we can confirm whether it is leprosy or some other disease. So people that look like leprosy need not necessarily have the disease. Similarly, there are deformities that look so much like the deformities that people affected by leprosy get, but are due to other neurological conditions. So just to reinforce, all they need to do is go to the correct doctor early and have their diagnosis verified. I'm sure everyone's thinking, why don't we have a vaccine for leprosy? It is sad. There's been research going on for years and years and years. And there are vaccines in the market. There are vaccines being studied. But there is no proven vaccine to prevent leprosy. So the mainstay, again, if we want to decrease leprosy in the country, everyone should know to come early. Everyone should know to take proper treatment. And this is where all of you can be of use and help us. Like Dr. Biswas said, India has the most of the world's leprosy. 60% is the figure they give us. 80% is what I believe. The number of absolute number is not so high. But if you look, every year, people are getting leprosy, people are getting deformity, disability. And if the cumulative figure, if you go on collecting, is a large number. And all those people who are left with residual deformity, they need lifelong care. They may get wounds, ulcers, they may need reconstructive surgery, they need physiotherapy. They are labeled leprosy affected for life. Whereas the person who comes with the patch, takes treatment, that's it, end of story. They may have the patch may stay, but they will not have any more leprosy or any more chance of nerve damage. Here again, showing us in the country where leprosy is more. I have in blue outlined the states, and you can see West Bengal, because Dr. Biswas, I think most of your viewers are from West Bengal. They are also listed in this. It is important. But I also want to say that even in the other states where they say leprosy is less, the number of new cases coming in is still the same. They're low, but they're still the same. The advantages, they come early, they are educated, they are aware, they come early, they take treatment, so they do not get so much deformity as we get in states like Uttar Pradesh, Bihar, Chhattisgarh, etc. This is the deformity that I was talking about. Here again, pictures of all little children. It's not that little children get it so much, but little children, when they get disability and deformity, it is very difficult for them. It's difficult for them to adjust in society, in school. It is difficult for them to learn and listen to us and protect their hands and feet from further injury. And by the time they're young adults, if we are not very careful and drill self-care into them, they lose digits. We can do reconstructive surgery, we can make it look normal, we can make it function normal, but that sensory loss is something we have to battle lifelong. And if you look at that graph on top, that line at the bottom, the yellow line, it shows that over 15 years, the absolute number of people who are getting grade 2 disability and deformity is still the same. And that is very sad. Okay. How can deformity due to leprosy be prevented? Again, to reinforce early diagnosis and treatment. I'm not going through all the rest. It will be covered later. And what can you do to help? Again, what you learned today, you can spread the information, the news that it is not spread by touch, that we must not be afraid of leprosy, that they come early for treatment, their whole life they can be well, help remove the stigma. There is no reason, no medical reason, no practical reason for the stigma associated with leprosy in our country. And of course, you can tell the person where to go for treatment. Usually it's a medical college, or if there is a leprosy center, and teach self-care is not important. So once again, I want to close and say thank you for listening. Thank you for your interest in leprosy. And I hand over now to Dr. Shamla, who's going to talk about the eye problems in leprosy. Go to that slide right there.
Biswas, your mic is muted.
I just wanted to thank and congratulate Dr. Loretta Das for the highly enlightening and reassuring talk. Very informative. Thank you. I do have a couple of questions for you, Dr. Loretta Das, but as decided by us earlier, we will keep the question for the end. So over to Dr. Shamla Anand, a fellow ophthalmologist who has, Dr. Shamla Anand, a fellow ophthalmologist, has performed thousands and thousands of cataract surgeries and many other ocular surgeries in leprosy patients. She has tremendous, a vast experience of ophthalmic surgeries in leprosy patients. And she is going to tell us something from her work life. Over to you, Sham.
Thank you, Biswas. Good afternoon, everybody. I am very happy to be here again, and thank you for inviting me. I shall just start sharing my screen. Are you able to see the screen? Biswas? Biswas, can you just tell me if you are able to see the screen? Okay. Okay, we have just finished an excellent.
Shamla, your screen is visible. Please go ahead.
Oh, thank you so much. I was waiting for some confirmation. Thank you. Sorry for wasting that time. So we've just finished an excellent overview on leprosy as a disease, and I'm here to tell you very simply how leprosy affects the eyes and causes blindness. So we have just learned that nerve damage in leprosy causes severe disability. If it is detected and treated late, as is very often the case, the loss of sensation is permanent and irreversible. Fortunately, reconstructive surgery can restore the function of paralyzed eyelids or fingers and feet to varying extents so that the person can continue to live and work as normally as possible. The thing we need to remember is that leprosy disability usually affects the poor, and it keeps them poor. These people usually live in resource-poor settings and find it hard to access treatment and surgery. Leprosy disability itself requires lifelong care, which is difficult to manage when you are poor. Perhaps the most important thing to remember is that it's the visible leprosy disability that is the cause for stigma and discrimination. Therefore, this is something that we never want to happen to a person who contracts leprosy. We don't have reliable estimates of how many people with leprosy actually have eye problems because this is not often documented or reported. But a few studies have shown wide ranges from 40% to 75%, and that is not a small number. So, how does leprosy cause blindness? Nerve damage causes loss of the protective sensation in the eye that causes us to blink, and paralysis of the eyelids means the person is unable to fully close the eye, as you can see in this picture. The ability to blink is what protects our eyes from drying out or being injured. And if this important blink reflex is lost, the eye is at high risk of external injury should something just fall into the eye. And it's also at risk of dryness. Without prompt treatment, blindness will occur. Another way that leprosy causes blindness is when the bacilli infiltrate the tissues of the eye and when there is inflammation during leprosy reactions. This leads to cataract and glaucoma. Left untreated, the person will become blind. Treatment is very long and difficult, and this young man in the picture was under treatment for a few years. But ignorance and deep-seated stigma also cause blindness. Let me tell you a true story that happened at the leprosy clinic in Hyderabad, where I was volunteering once a week to see eye patients. On the same campus and run by the same management and board was a charitable state-of-the-art eye hospital, supposedly committed to delivering eye care to the poor and needy. This 35-year-old man was totally blind for 3 months when he was brought to me by his friend who lived in the neighboring village. He has 2 small children, and his wife, tired of taking him by the hand to the toilet, was threatening to leave him. I found he had total cataracts in both eyes from taking steroids on his own for his repeated reactions. He had been unable to visit the hospital due to his deteriorating vision. I messaged the ophthalmologist at the eye hospital next door, and she was really happy to operate him. And I was able to reassure the patient that he would soon be able to see. However, when I did send him there, and unknown to me, that same day he was kept waiting till 5 p.m. and told that he would not be taken for surgery. He visited a second time to the eye center in that hospital and was told the same thing. 3 months later, the man who had brought him met me and told me that he was still blind for 6 months in his village. That's when I found out that all the patients I had sent there were treated exactly the same way. When I complained, I was informed that a management decision had to be taken regarding whether leprosy patients can be examined there or even operated there. So, of course, I escalated my complaints, and finally it went to the board. A special board meeting was called, and the decision was taken that they would operate leprosy patients in that hospital. But I was also told that my services would no longer be required. I suspect it was because I had forced their hand. I mean, it didn't really matter because I was volunteering there for free, but it certainly did hurt my pride a little bit. Anyway, later I was informed and sent pictures of this patient after he had both his eyes operated. This was by someone in the lower management of the eye hospital who was not party to all this discrimination. So this true story, which is not even 2 years old, illustrates how blindness is the ultimate disability, and we just cannot let it happen because it creates completely total dependence and vulnerability. And any health worker should be able to screen and suspect, refer a person and follow up, as I had failed to do, and then I found out later that it wasn't working, and even educate the patient and follow up with the patient. But that's what health workers can do. I'm going to end with what you and I can do. Let's remember that leprosy still exists, so let us be very aware. The lifelong vigilance and self-care that is required is often beyond the means of the poor suffering person to practice, so let us be compassionate. There is a lot of self-stigma and fear experienced. Let us be kind. There is difficulty in getting the right aids, even like protective glasses. So please donate to leprosy organizations that are doing good and dedicated work. And finally, people have to cope with society's discrimination, including by medical professionals. Let us educate and let us stand up against discrimination. We have seen how a person continues to live with leprosy long after it is cured. Let us make it easier for them. Thank you very much for your patient listening.
Dr. Shamla, your presentation was very touching. It did touch a chord in my heart. Thank you. And it also opened up my eyes to this stigma-filled disease. And I hope and believe that many of our viewers will experience the same. I also do have a couple of questions for you regarding the stigma and ocular leprosy, but we'll keep the questions until the end. Thank you once again. We will now invite Dr. Premal Das. Dr. Premal Das, as I mentioned earlier, has been working in the field of leprosy, correction and prevention of deformities. He has performed more than 15,000 tendon transfer surgeries for deformed hands and feet, more than 1,000 nerve decompression surgeries. He has introduced the LASSO surgery for mobile claw hand correction into the leprosy mission of India. He has designed several accessories like special footwear and other corrective accessories for leprosy patients. Welcome once again, Professor Das, and over to you again for your views and sharing your experience with leprosy with us.
Thanks, Biswas, for all that. Let me see if this works. Tell me if you can see my screen.
Hang on. I think I have to add your screen. Yes, now we can see your screen.
Okay. This is where my dear wife and I work in Naini, Allahabad. It's a hospital which is purely dedicated mostly dedicated for leprosy. This is leprosy. This is somebody 20 years lots of bacteria in this slide. So this is current status, this is present. This is the past. This was leprosy. Somebody neglected, did not get treatment, probably from the pre-MDT era. Okay, this is not my thing. My of presenting was to tell you about reconstructive surgery, the options that we have to correct deformity and bring them back to normality. Usually the patients who need tendon transfers are a younger group. They can change their future and of course that of the community. We don't have enough surgeons doing leprosy, so we organize it in camps. So we go to different hospitals where they collect a large number of patients and we go ahead and operate. And these are some of the camps which we have in leprosy mission. The commonest surgery we do is LASSO, which is for the hand because that is the commonest deformity, the claw hand that they get. The RCS consists of a lot of physiotherapy, that is pre-op and post-op physiotherapy. And of course, occupational therapy, which is in the third week, telling them how to adapt to their deformity and to their corrected newer muscles that they've used. The commonest surgery I told you is LASSO. So that's a pre-op claw hand, and that's post-op when he can get his fingers straight. That's the same. That's another patient to show you that you can get the fist and be fairly normal. And well, age used to be a criteria before, but I don't think it's so much now. If the patient is adequately motivated, and nothing like getting the smile back on that person's face. So yeah. I haven't forgotten about the eye, so we will show you a little bit of the temporalis transfer, which is what we do. This is a tendon transfer to correct the lagophthalmus from the paralysis of the orbicularis oculi. The temporalis muscle is the main tendon, and we use a graft, which is the palmaris or the fascia lata. So that's the lagophthalmus. Yeah, she has a hand too, but just look at the eyes. And when she closes it, you can see the lagophthalmus on the left side. And then this is after you operated. If you are fortunate, you get a nice thing where they can get good closure. This is somebody who had it only on one side, which is always a little tricky because you want to get that both the eyes to look equal, but you can see that the left eye has been operated and the tendon slip is just about visible there. The idea of reconstructive surgery is to take somebody who's there, the left-hand side of my screen, and she was somebody who came in with lots and lots of deformities. She had about 11 reconstructive surgeries, including claw toes and hands and thumbs and both eyes, and including she wanted an angle of her face up there, and she wanted it because she wanted to put nail polish. So this is a little old. She's now married with 2 children. So I think that's a good positive step that we have. And that's all I have to say. Okay, this is somebody who's operated this girl. I don't think so. Her hand looks fairly normal, which is what the aim is. Thank you.
Well, Dr. Das, your treatment visuals were mind-boggling, to say the least. I mean, they make me, and I'm sure they'll make any health worker or doctor proud to see what magic you can make in deformed hands and feet. Excellent. Hats off to you. And we will bring in all the other speakers into the stream now, so that we can have a kind of a panel discussion among ourselves. And they will bring in. Can we have a discussion on the subject amongst ourselves? We will include the
Sure.
specialists of leprosy. Dr. Lotta D'Souza, I'll ask you about something. You spoke about vaccine for leprosy. Now, my question is, why do you need a vaccine? Because I remember having read somewhere that 95% of people who contact the organism do not develop disease. So the bacilli is there. We are all exposed to the bacilli, but 95% of us do not develop the disease. So do we really need a vaccine also? Also, you also mentioned that the disease is completely incurable, which we all know it is. So then why do we need a vaccine?
Excellent question. But like I said, though we have been treating leprosy for so many years, like from 1980, we had good, strong drugs to treat leprosy. The problem is we still get the same number of cases, though WHO and Government of India says leprosy is eliminated. We still keep on getting, even in better states, what I call better states, Tamil Nadu and Karnataka and everywhere, you keep getting the same number of new leprosy cases. Now, why do you get this? Because those people are sitting in the incubation period with lot of germs. That particular, like the vaccine would be very useful to treat members of the family of an index case, to treat high endemic areas. I'm not saying the whole world has to get the vaccine, because 95% of us are immune. But the areas where you find lesser immunity and more leprosy, the pockets, we have a lot of endemic pockets of leprosy, especially in Uttar Pradesh, Chhattisgarh, Orissa, West Bengal, lot of pockets high endemic and a lot of families like I showed you. So if I get one case and I immunize the whole family, if I had a good vaccine, we still immunize but we don't have a good vaccine, then the chances of anyone in that family developing the disease is minimized. And so even though leprosy numbers, absolute numbers are so low, this deformity and disability for that particular affected person is lifelong.
Yeah, I get your point. Thanks for the clarification. I understand your point. I have one more question for you, Dr. Das. You mentioned about patches being the commonest sign of leprosy, but you also mentioned that not all patches need be leprosy. Of course, that's true. So, for a red patch, what would be the commonest differential diagnosis from the medical point of view? Like, what are the other things that can pose like leprosy if the patient has a reddish patch?
Well, before I come to that, if the patch has loss of sensation, if it is anesthetic, then we know it is leprosy. That's just one side. Okay, I didn't emphasize that because I thought it's not so much medical. But a reddish patch could be a fungal infection in a fair skin. It could be psoriasis. It could be lupus erythematosus, discoid lupus erythematosus. I think you need a dermatologist, but I can tell you the few differentials. Urticaria. There are a lot of lesions where it is not leprosy, but it can look like leprosy, reddish patches. Similarly, patches. Yeah.
I have a personal reason why I asked you this question. I'm presently seeing a patient, one young lady with a reddish patch around the eyes, and I have not been able to arrive at a definitive diagnosis. So I was wondering what else could it be. That's why I asked.
Get a dermatologist into the picture if possible.
Yeah. Thank you. Dr. Shamla Anand, your talk was as enjoyable and as touching, very touching. Can you unmute yourself, Dr. Shamla Anand, please?
Sure. Yes.
Okay. So you said about 40 to 75% of leprosy patients can have ocular leprosy. That's a very, very high number. And we know that apart from cataract, the other common disease that occurs in the eyes is uveitis, right?
Yes.
Popularly known as iritis by the local public in Bengal, although the correct term is uveitis. Now, my question is, when we see a patient of uveitis, we do screen a patient for other systemic disorders such as tuberculosis, for collagen disorder, for rheumatic disease. Why do we not ever think of leprosy as a possibility? Because in most of the uveitis patients, we are not able to arrive at a correct cause. Is it necessary to screen a patient for leprosy in a case of uveitis?
That's a very good question, Biswas. As we know that most of the time the diagnosis of uveitis is one of exclusion. It's extremely difficult in most cases to get a diagnosis of uveitis in any disease. But in leprosy, uveitis is usually always associated with lepra reactions. It's also seen in multivacillary patients. So they will have other evidences, outward signs of leprosy. They will have maybe the thickened skin or the infiltrated skin. They may have, they will be quite sick, some of them, and they will usually have some of the other like nodules or reddish, well, not really reddish, they'd be quite sick, fever and other signs and symptoms of a leprosy reaction. It's unlikely we will see uveitis without it. But if you examine many, I mean, because we were seeing leprosy patients, if I put them in front of the slit lamp, it's not uncommon to find cells. It's not uncommon to find the low-grade uveitis, which is obviously going to be missed if it's just infiltration. It's only when they have a reaction and then there's the inflammation, you will see it. And most of the times what you will commonly see is you will see some cyanogen or a very pinpoint pupil or something like that, but you will get a past history of treatment for leprosy, or there will be obvious signs of leprosy. I wouldn't say put it as your first differential diagnosis, because there will be obvious signs. But good to keep it in mind. Common things are common.
Mm-hmm. Yeah. Thank you for that clarifying. To the other panelists, would you guys like to add anything? I have a question for Dr. Premal Das as well. If any of you would like to add anything or comment anything so far, please go ahead. Nothing? Dr. Premal Das, you highlighted these cases of these corrective surgeries, which I felt was mind-boggling and phenomenal. I mean, excellent. I mean, cannot imagine that a person can have a normal hand after such a huge deformity. Now, up to what stage of deformity are these corrections possible? Did you hear me?
I think my net kept cutting off, so I'm not sure if I heard you fully.
Okay,
No, just tell me what is that?
This corrective surgeries that you demonstrated through your slides, up to what stage of deformity can these corrective surgeries be performed with success? Meaning, is there a defined stage, or you can try it out at
okay. See, firstly, we will not do the surgery until about 6 months of deformity, because by the time you expect can you hear me?
Yes, I can.
You expect the nerve to recover within 6 months. So we call that early neuritis, and we try and the fact is most patients come to us much after 6 months with the deformity. So the average delay for a hand is about 5 years. Now, if it's 5 years and they've got a very stiff hand, physiotherapy will try and release it, because we are a specialized center. We can spend a lot of time, and our physiotherapists are very good. We would spend a lot of time in trying to release that hand and do some kind of surgery. Obviously, the fingers have gone and all the stuff, there's not point doing surgery. But a lot of the contractures can get released. So I think there's no duration or stage, though some people like to put in something like 3 years or 5 years. But I think it's a lot of it is possible. It takes a lot more hard work on the part of the physiotherapist. The surgeon has to do the same old rubbish. So it's just the physiotherapist who has to work quite harder.
Okay, I get it. My last question to you, Dr. Premal Das, is about this thing related to stigma, which we know and have been highlighted in numerous Indian movies in the past. So I remember having read somewhere that until 2019, a married person could file a case of divorce against a spouse who has been diagnosed to have leprosy. Is this true? That's just about until 2 years ago. Was this law there in Indian laws? Did you hear me, Dr. Premal Das?
You want me to answer? I thought anyway Shyam was going to do it. Yeah, I think there are about 119 laws that are... Okay, my net is really playing up. There are a whole lot of laws, 119 laws that they talk about, which is part of a project that the Leprosy Mission was doing to sit down and try and repeal these laws. So I think the process is there. Yes, lots of things can be done. You can't travel in a train. You can't do this. You can't do that. It's to travel in a train. But there are lots and lots of these laws. Yes, you can't own property. There are 119 of these laws, and yes, they are repealing a lot of them. And I think the government has been very proactive in sitting around and working towards leprosy. So I think that's why these laws are coming through. So, yeah.
Great.
Did you hear me?
Yeah. Yeah. We are all in, and we have had a very healthy discussion on leprosy, and I'm sure many and most of our viewers would have benefited to know what leprosy actually is and what we need to do as fellow citizens. If there are any other points which you specialists, leprosy specialists, so to say, would like to add on, we can. Otherwise, we are nearing the close of our session. Dr. Loretta Das, is there any parting remark that you would like to make?
This was
I wanted
to make
Yes, please. Please. Sure.
I wanted to say that in the case of uveitis, irrespective of the cause, the treatment will be the same
Yes.
in the case. But I forgot to say that you must ask for a history if the person has taken treatment. So remember that, even though you don't have to do any special tests, you can just ask.
Sure. Thank you. Dr. Loretta
And
Das,
I want to say a big thank you to you, especially, and to your Sunetra family, because you have given us an opportunity to tell many people what we want to tell about leprosy. Thank you very much. And if I can add on a personal note, thank you for your support. Like Dr. Shamla said, so difficult to get cataract surgery done for people affected by leprosy. And you have been visiting us and doing surgery for our patients for quite a few years. Thank you.
it has been a pleasure and honor as well. Thank you for the opportunity, Dr. Loretta and Dr. Premal. I have been to your hospital and seen the excellent work you guys are doing.
Boss.
Thank you, Dr. Premal Das. Anything else you'd like to say?
I was just thinking of when Sham was telling us a story, and I said we are so fortunate to get somebody from Calcutta, like in your with your expertise, to come around and operate on our patients out here. Because when Sham was telling us about all this happening in Hyderabad, I was thinking, I said our patients are so fortunate to get the best of the lot coming around here and operating. So thanks a lot, and thank you for bringing your team from Sunetra as well. They've always been very cooperative here.
It has been a pleasure, honor, and a good learning experience for us. Very good. Thank you. Thank you. So thank you all once again, and we come to an end of a wonderful session, and we hope to come on air once again sometime later with a similar or a same topic sometime later again. Thank you once again for being in the show.
Thank you very much.
Okay.
Thank you.
Bye-bye.
Bye.